So today I will be talking about what are pharyngeal arches and what are their derivatives. It's one of the important topic regarding various exams, and there are so many MCQs about pharyngeal arches and their derivatives. So pharyngeal arches are series of mesodermal outpouchings which occur along the sides of developing pharynx. They are 6 in numbers. The fifth pharyngeal arch does not contribute any useful structures and fuses with the sixth pharyngeal arch. So, the derivatives of pharyngeal arches include the muscles, the bones and cartilages, the artery, nerve, and there is some endocrine contribution as well. So the first pharyngeal arch gives rise to muscles of mastication, anterior belly of digastric, mylohyoid, tensor tympani, and tensor villi palatini muscles. The first pharyngeal arch, bony or skeletal derivatives are maxillary bone, incus, malleus, and Meckel's cartilage. The first pharyngeal arch also gives rise to maxillary artery and external carotid artery, while the nerve that derives from first pharyngeal arch is mandibular nerve, and there is no endocrine contribution from first pharyngeal arch. The second pharyngeal arch gives rise to buccinator muscle, platysma muscle, muscles of facial expression, stylohyoid, stapedius, and posterior belly of digastric muscle. The bony contribution from second pharyngeal arch includes the stapes muscle, the stapes bone, styloid process of the hyoid, lesser corn of the hyoid, and upper body of the hyoid bone. The second pharyngeal arch arterial derivatives include the inferior branch of superior thyroid artery and the stapedial artery. The nerve derivatives of second pharyngeal arch is facial nerve, while again there is no endocrine contribution from second pharyngeal arch. The third pharyngeal arch, which gives rise to muscle, is stylopharyngeus, and its skeletal contribution is the greater horn, and the lower part of the hyoid bone also arises from the third pharyngeal arch. The arterial contribution from third pharyngeal arch is common and internal carotid arteries, while the nerve that derives from third pharyngeal arch is glossopharyngeal nerve, and from third pharyngeal arch there is endocrine contribution, and the thymus gland and two inferior parathyroid glands. These endocrine structure, also derived from the third pharyngeal arch. The fourth pharyngeal arch gives rise to muscle, and they are cricothyroid and all intrinsic muscle of the soft palate, while the skeletal contribution is towards the thyroid and epiglottic cartilages. The arterial derivatives are right subclavian and left aortic arch, right subclavian artery and left aortic arch, while the nerve that derived from fourth pharyngeal arch is vagus nerve, and any endocrine contribution from the fourth pharyngeal arch includes the superior parathyroid glands. There is no fifth pharyngeal arch, and it doesn't contribute towards any structure, and it gets fused with the sixth pharyngeal arch. So the derivatives from the sixth pharyngeal arch includes all intrinsic muscles of the larynx except cricothyroid, because cricothyroid is derived from fourth pharyngeal arch. The cartilaginous structure that arises from the sixth pharyngeal arch is the cricothyroid, arytenoid, and corniculate cartilages. The arterial derivatives of sixth pharyngeal arch include the right pulmonary artery, the left pulmonary artery, and the ductus arteriosus, while the nerve derivatives include the vagus nerve and recurrent laryngeal nerve. And again, there is no endocrine contribution from sixth pharyngeal arch. Thank you.